My name is Vanessa, and I'm a registered social worker working in ICCMW, Integrated Center for Community Mental Wellness.
Thank you, Vanessa Yu, for doing the interview with us. So recently, there's a murder case in Sao Mau Ping. A man who has mental illness records stabbed his neighbor to death in his residence. And actually, in the past year, there have been a few similar cases like this in Hong Kong, all relating to violent attack launched by mentally ill outpatients. So as a social worker, is this such a surprise for you to hear about the tragedy in Sao Mau Ping?
Tragedy always happened in the past few years, especially under the situation like now, the resources is really insufficient, especially in the mental health field. After the patient have been discharged from the psychiatric hospital, they will normally receive services from the medical social worker or the ICCMW, which is the place that I'm working on it. However, each social worker bear around 60 to 70 cases, which is we cannot pay a lot of attention to each cases. Which means we didn't have enough time to monitor whether the patient have taken their medicine or whether their mental status is stable or not.
Would you tell us more about which type of mental illness is prone to this kind of violent attack or is prone to affecting the neighbors around them?
Well, I cannot say there is any particular type of mental illness which cause this kind of violence. Actually, I have to reframe about what you're saying. A normal person without mental disorder will have a violent tendency or aggressive tendency as well. And even some statistics shows that normal person have a higher violence record more than the mental illness patient. But according to these cases, I don't know much about the murder background, but I suspected they may have some delusion at the time that he commits such crime. So with delusion, we can say that he may have schizophrenia or even have some other diseases like psychosis as well.
When these kind of patients are taken to maybe the psychiatric hospital or the doctors, who would decide whether this patient is ready or is okay to be back to their own neighborhood?
Normally, the psychiatrist in the hospital would be responsible for deciding whether the patient would be allowed to be discharged from the psychiatric hospital. It depends on a few criteria, which mainly decided on his medicine taking habits, his recognition of whether he got a mental illness, his awareness of his mental status, as well as the family support and the support available around the patients. So actually, it is the common practice in the whole world as well.
So do you think the lack of resources to take care of these mentally ill patients is the cause for this kind of tragedy?
I am not sure about that. It may be one of the factors which contribute to the tragedy, especially when this person already have mental illness record, which means he have a social worker following up his case. There's as a social worker, I have experienced that the patients, especially in the community, which they have many different kinds of skills, hiding whether they have taken their medicine accordingly. So as a social worker having so many cases on hand, it seems impossible for us to track whether the patient have taken their medicine on time or not. So there is another way that's suggested by the government, which is taking injection instead of taking pills, which have a better way. However, most of the patient reject or feeling not comfortable for taking injection instead of taking pills. So it also contributes to how the community perceive the treatment on mental illness would affect their own mental status as well.
There has been some psychiatrists proposing that the government should set up a law to enforce those patients to go back to see the doctors or take medicines. Do you think that is an effective suggestion to help with the problem?
It may be effective. However, there is also many shortcomings considering the human rights, or we are hoping as a social worker, we hope the patient himself can voluntarily take the treatment because we treat them as a human, not a object or not as something that just following orders. We want them to aware their mental status, and then we help them to recover from their mental illness instead of giving orders that you have to do this, we have to do this, which really have some contradiction to what we believe, which is the patient's autonomy in deciding their recovery journey.
Thank you, Vanessa, for giving us the insight.